So just to summarize, in summary, so takeaway points would be you want to make sure that you definitely encourage breastfeeding. We talked about all the good stuff that in my slides, all of the good pointers you can give to your patients to say, to make them encourage breastfeeding. In GDM, or it doesn't matter, GDM, type 1, type 2, breastfeeding is great across all kinds of diabetes during pregnancy. And talk about benefits of breastfeeding for the baby and for mom in terms of glucose control. Because when you talk about the benefits of breastfeeding on glucose, it highly motivates the women. And also talking about bonding between the infant and the mom. And also place emphasis on importance of eating, meeting nutrition needs during lactation, and also talking about calories during weaning. And birth control, very, very important. Make sure you talk about birth control way before the mom delivers. If she needs any support after birth, feel free, encourage them to make an appointment so that you can talk to them about that. And depression screening, I would highly recommend that. A lot of the women end up into postpartum blues, and some of them are through antepartum going into postpartum. So talking about, picking up the signs and symptoms of depression, and at that point, making sure you do a screening and make appropriate referrals to the to the provider or appropriate places, and discuss as a team for interventions to be done. Great, so that finishes my talk. I am open to taking any questions.
Thank you very much, Geetha. We do have some questions. We've got about 5 minutes, but we'll keep going until you tell me that you have to go. Until we're done with the questions. So the first one was, can you share your comments on women who smoke and want to breastfeed?
That's a hard one. I think it's kind of hard. So what I haven't had a woman, probably a long time ago, but I would say maybe talk about breastfeeding women who want to breastfeed, but talk about how smoking could affect the babies, all the things that we talked about, the risk factors of not breastfeeding, how smoke can affect the baby's motor skills and IQ level. So we are focusing a lot on the damage that smoking can do. So I would see a lot of education probably should come from what smoke can do for the baby's growth. So many times when you're talking about the baby and the baby's growth, the intellectual development, motor skills, that motivates the women to kind of taper off. So one of the strong things I would do is first a referral and, refer them out to different appropriate or provide them resources and get into programs for quitting. There are a lot of helplines, and refer to your resource centers in the facility and have them educate on how smoking can affect the growth of the baby. Basically building up on that would help them. So your focus is just tapering the smoke, frequency of that, and then talking about the benefits of breastfeeding. So I think that's what I would go into, but I still would encourage breastfeeding, but you want to make sure that they really tapered off on that.
Thank you.
So I hope that answers.
Okay, next one. Can you repeat the average milk production per day of breastfeeding moms?
Sure, I will. Okay. So the average milk production is about 0.78 liters per day from birth to 6 months, and 0.6 liters per day from 7 to 12 months.
Yeah, thank you. Okay, next question. What oatmeal increases milk production, and how can mom with diabetes handle it? Just add protein?
So when you're talking about oatmeal to increase milk production, I know there are a lot of people talk about food, different kinds of food. Oatmeal is a good food, but obviously we always talk about long cooking oatmeal like the steel cut oats. But we're talking about calories. I mean, oatmeal is a good thing, like I said, but we're talking about total calories, which is going to help the milk production than a specific food. We definitely first want to talk about increasing your calories and then going into the good kind of foods. Definitely oatmeal, long cooking will help with milk production. And adding protein is definitely going to, so every time we talk about is make sure that you have the carbs with the protein. For sure, yes, you would add protein with oatmeal to make it more balanced so that when you add protein, your sugars kind of look more controlled along with the carbs.
Thank you. Next question. Can you clarify the kcals per grams of mom breastfeeding but weaning? How often is she, I'm sorry, the second part is part of a different question. So the kcals per grams of mom breastfeeding but weaning.
Okay, so so the grams for carbohydrate grams for someone who's weaning would be 130 grams per day.
Okay, thank you. I'm sorry, I got.
So I think the calories. I'm sorry, going back into that. I think it was calories. So the calories are about 1,200 calories per day. It could be 1,200 calories per day, and carbs being 130 grams per day.
Perfect. Thank you. How do you manage women who have been given Depo-Provera that lasts 12 to 13 weeks?
Okay. So you're talking about last 12 to 13 weeks of?
Sorry, this is just the way the question came through.
Okay.
You were talking about birth control. How do you, I guess somebody who's been given Depo postpartum? Does that happen?
Okay. Yeah, I would say if so I'm assuming, so I wasn't clear on the last 12 to 13 weeks, but I'm assuming that if someone was already given a Depo for the last 12 to 13 weeks postpartum, obviously the sugars probably, I'm assuming it's a GDM, so I would say probably you'll have to check your sugars more often to see if it is actually doubling or tripling your sugar levels. So at that point, I think I would try to manage the sugars much better with, it has to be maybe a carb control and try to be more active and put in more exercise to kind of manage your sugars. Because if they're already on Depo, probably the sugars could be going high.